a step-by-step guide to the extraction of a tooth. So first of all, use the smallest periosteal elevator with the sharp tip. Now enter the interdental papillary region and work on it. Make sure you have supported valve and work around the gingival sulcus and cut the interdental papilla. If you don't cut, you cannot reflect. So this step is extremely important, and roll the instrument between your finger and the thumb. The rolling motion is important. Now take the bigger periosteal elevator and work in the same way, okay, all around the tooth. The concave part of the periosteal elevator should be towards the tooth. Once you reflect, entire flap, it should be mucoperiosteal flap, that is full thickness flap. Okay, so you should be able to see the bone tooth margin. Okay, expose the CJ or bone tooth margin or alveolar bone margin. Now repeat the reflection steps lingually. Lingually now will be easier. Always start with buccal reflection first, as lingual and palatal sides are very difficult. So whenever you are doing lingual side, make sure the angulation of the tip should be facing upward, so that in case it slips, it will not damage the deeper structures. Now apply the forceps. You can use the figure of 8 or round and round movement. Figure of 8 would be helpful in the multi-rooted teeth. Round and round for the anterior teeth up to the premolars. So you can see here, even though the tooth are not so difficult to extract, but a round and round movement will ensure there is no inadvertent fractures of the cortical plates. So it's a slow and gentle method. Keep working on the all teeth. Multiple teeth require this round and round movement will ensure intact interdental bone. So in case you are planning implant, it will help you in maintaining the bone height as well as the width. Once you have done the extractions, now clean the sockets, check for the integrity of cortical plates and any tear in the mucosa. Now the next step is alveoloplasty. You have to remove the bone only the margins or 1 or 2 mm margins of the interdental bone which are projected above the gingival margins. Otherwise it will develop into dry socket, probability of getting dry socket. So very small margins, 1 to 2 millimeter, as if you are clipping your nails. Likewise, keep doing alveoloplasty for all the interdental bone, and also make sure that any buccal or lingual margins, if they are projected above, then you can do for that also. Now compress the socket firmly with the use of 2 thumbs. Now everything is clear and clean. You can proceed with the suturing. Suturing, you start from papilla to papilla. In this case, where we have not given any incision, so only papilla to papilla suturing will do. Interrupted papillary suture. The suture ensures that healing is fast, and the next step of prosthodontic rehabilitation can be undertaken quickly. So these are the steps of an ideal tooth extraction. At the end, observe following points. There should not be any ooze or any cuts margins open. Both the sides bone margins are properly covered with the gingival flap. There should not be any sharp spicules of the bone projecting through the gingiva, palpable buccally or lingually.